as a medic, when I'm looking at, if I know somebody has these problems, the first thing I'm going to want to do as a medic, once I go through my training, is I'm going to want to better understand how it is to assess a patient. So we're going to do the basics, the vitals and BP, check the heart rate. They usually do a vision, usually go like that. Breathing, we use that to calm the patient down. Then I do a head-to-toe assessment. Say there's a foot injury and head injury. Say there was a cut on the head. So obviously I'm going to clean that and bandage it up properly. If it's a foot injury, same thing. We just hurry up and say it's like a broken ankle. I'm going to want to keep it secure and stable. Okay? Drugs and alcohol. If I see these are the factors, obviously I'm going to want to do a consult with a doctor, and that's usually through. In this case, I have to look at it manually, okay? I'm on the field, and all I have is a small medical bag, and I have my Narcan. If I have the approvals through the state, I'm licensed to make a small recommendation, and then I see the patient's file, coordinate with a social worker, and we can assess the patient quickly, get them to the right care immediately. When they go through a hospital, though, there's a transfer and all that stuff. That's where you get into this. We'd like to be able to assess a patient really quick. But in the field, say there is electronical grid going down. That's the problem that a lot of people aren't paying attention to. So if you're used to doing things on electronic file and you don't have access to any kind of pharmacology or pharmacy, these are the things that I'm looking at, okay? I'm looking at what can we treat the patient with. Well, we want to have the Narcan with us because this is the patient we're dealing with. Patient A may have been exposed to fentanyl, which now I would assess this as exactly the problem we run into because we're not trained. So we're going to go through this over again, okay? So let's run through this one more time. Patient A. She has a stress and anxiety condition A. So we're going to go immediately and bring her back to from hypervigilant to down to this. That's the 10, 7, 3, 5, 2, 4, 1. And then we go ahead, do the normal vitals, BP, blood pressure, all that says vision assessment, where you take the pen and you make sure they can focus in and they follow your eyes. We're going to look for their pupils being dilated. And obviously, if I talk to the patient and they're coherent, then I'll know that they can tell me that whether they have an anxiety condition. But that's why we'll just go ahead and do that. Because usually, typically, in a high anxiety, I'm going to want to do the 10, 7, 3, 5, 2, 4, 1. Because that's typically what you're dealing with if somebody's been exposed to some kind of chemical or drug, okay? Immediately, we're going to check and see. We'll do the head-to-toe assessment. Foot injuries, say there's a foot injury. We also want to know if these are the factors and talk to the doctor. Get them in a proper detox because that's dangerous if we don't. So obviously, once they coordinate with a social worker and the doctors, they can assess it quickly. We get on to the next patient.